So the topic today is cross-addiction, or transfer addiction is another term that we use for that. So in your handout, you'll see I've outlined the different areas that we'll cover as we go through this. So first of all, I just want to give you the definition of addiction itself. So the definition that really captures the true essence of addiction is this: the state of being enslaved to a habit or practice that is physiologically or physically detrimental to your health and well-being. Addiction is a physiological state where the body and brain crave and adapt to the substance being used in a way that gradually requires increased amounts of that substance to achieve the same results. So that might sound familiar to some of you. So the word addiction is actually derived from the Latin terms enslaved by or bound to. So food addiction is what we'll talk a bit about first. And what is food addiction? So it's been established scientifically that patients can be addicted to food in the same way that you can be addicted to other substances. So the symptoms are strong craving, difficulty controlling eating, taking the substance, which is food, in increasing amounts, being unable to cut back for very long, and using the substance, food, despite the effect on health, relationships, self-esteem, and/or work. And there's an acronym as psychologists that we use to assess addictions, and it's the CAGE acronym, which is, have you tried to cut back on the substance? Have people told you that they're annoyed with your use of the substance, so it's causing effects in your relationship? Do you feel guilty about using that substance? And this one doesn't apply quite as much to food as other substances, the early morning use. So if there are 2 of the 4 of those CAGE symptoms, then it's known to be a problem that needs further addressing or assessment. So food causes an addiction because it can operate on the reward centers in the brain in the same way that a drug might. So the brain registers all pleasure in the same way, whether it's originating as a drug or as comfort food, as a pleasurable meal. So comfort food triggers the pleasure center of the brain, which ignites our dopamine and perpetuates the addiction. So dopamine is released in the brain, and it activates those pleasure centers. And when you're told that the comfort foods are bad for you, it's not just because of the carbs and the calories that they're bad for you, but just the chemical substances of the comfort foods and what they do to the brain, that causes it to be bad for us. So if a person uses food to handle stress or strong emotions, especially for comfort, and they haven't done the psychological work to understand how and why they're using the food, then they look to something else to fill that void when they no longer have food. So that's what happens with weight loss surgery. You're removing food as a comfort, and so oftentimes if you haven't figured out why you're doing that, then you have this addiction and you're looking for another substance to fill the void. That's the picture on your outline of the whack-a-mole game. I don't know if anybody's ever played that, where you pound on one thing and another thing pops up, right? So that's the concept. You're getting rid of something, but something else is popping up in its place. So that's addiction transfer. So addiction transfer is when the initial addiction was never really dealt with. In this case, it's food. So there's still that addiction component in the brain, because we talked about how addiction is brain-based. So the addiction component in the brain was never really resolved. And so a new addiction blossoms, replacing the old one. So if the brain is wired for addiction, then you have to have vigilance with every potentially addictive behavior. And you can think of a lot of things as addiction. Common ones: gambling, alcohol, smoking, sex, work, exercise, prescription medication, and a newer one, internet addiction. That's becoming more and more.
Do all of those things ignite the dopamine?
Yes, yes. They all can ignite the same reward centers in the brain. Good question. So those become the new go-to. So you have to constantly be vigilant that there are lots of, and I don't know, there probably are some addictions I haven't mentioned, but those are the ones that come to mind first. The brain explanation of it is that the reptilian brain is what controls our impulses, and the reptilian brain calls the shots, and it's what's been positively being reinforced through our addictive behaviors. And it's the first that's developed. The more complex forebrain is the one that helps us to think, but it's slower to react. So what we're trying to help you do in overcoming addictions is to help you not be impulsive and overcome that reptilian impulse and be more thoughtful. But it takes a lot of work. Any questions? Other questions so far? Okay.
When you are increasing the dopamine, is you can talk about if your body's used to that rush or used to that, what do you do? Replacing medications?
We're going to talk about that more.
Okay.
Yeah, the ways to change it. Okay. So, some of the addictions that are more prominent in this population would be alcohol. The National Institute of Drug Abuse has conducted research that shows there's a strong correlation between the gastric bypass surgery and an increase in alcohol consumption. And I know that's something that you've gone over somewhat in the classes, but you know that you're more sensitive after surgery, absorbing 50% more alcohol for each drink that's consumed, because alcohol spends less time in the stomach without food and is absorbed by the intestines rapidly. And then smoking. Many people have used smoking to deal with stress or to keep weight off even. And so when we remove that, there's a higher risk. When you're still smoking, there's a higher risk for complications and hospital readmission. So if you return to that once you've removed food, then that's very problematic. And in the handout that I have, there's some resources that you can go to, websites, and there's a book called The Easy Way to Quit Smoking that's listed in there as well. Then I mentioned before internet. Just because I think this is becoming more and more problematic, that people addicted to the internet often experience negative emotions or withdrawal symptoms when the internet access is restricted, and it definitely can cause a strain on relationships and interfere with obligations. And I've treated some adolescents for internet addiction, and it really has to be a family affair dealing with those addictions. So we mentioned the other ones: exercise, shopping, gambling, sex, work. Any that I haven't mentioned that come to your mind? Right, prescription medication or other drugs, sure. Okay. So addiction can be managed successfully. Once you experience one addiction, you're at risk for developing another addiction. We talked about the brain-based reason that might be. So is it ever really possible to be free from addiction? It's thought that addiction is a disease and it can't really be cured, but like other chronic diseases, it can be managed. And so you have to be very vigilant always about that potential. And there's a quote from a psychologist who's done a lot of research in addiction. And he says, "Addiction is more than a disease, it is a lifestyle. Lasting change only happens when you address the core issues driving you." the core issues driving you to seek comfort or pleasure from a destructive source outside of yourself. So in some cases, that core issue can be mental health issues, right? Like depression and anxiety. And they can be managed alongside the addiction, but you really have to be cognizant of them, aware of them, and get the help. So part and parcel of any addiction and what perpetuates that addiction is that the addict is really uncomfortable with being uncomfortable. So the substance removes the discomfort. So part of the treatment is helping deal with that discomfort, feeling the discomfort in a kind of safe way and a guided way through treatment. So some of the things that you can do if you feel like this is an issue, of course, I mentioned getting help. Addiction is the system of urges and thoughts that can be met with creativity instead of shame. So it's dealing with those urges in a creative way and being guided to do that. You can fill the void with healthy habits that reflect who you are, your interests and passions in your life. And you can fill the void by dealing with the personal issues and the feelings that you've been suppressing and trying to manage on your own. So getting help for those destructive habits. There's a program that has been put together by a psychologist who specializes in bariatric medicine, and she has a program called Full from Within. And she says that for one to be truly full, we must first clear out the toxicity, wounds, and hurtful schemas we've picked up throughout the years. And she says, again, there's no really getting over it. You kind of have to go through it. You have to feel it to heal it, is her philosophy. So addictions often are the avoidance of the feeling, and through help, you learn how to feel the feeling, feel uncomfortable, tolerate it, and learn how to manage it. So we're taught in our society oftentimes that it's not good to feel, or we want a quick fix, and that oftentimes that leads to going to your doctor and asking for medication. And it's not that I believe medication is bad. It's only bad when I feel it's avoiding dealing with the issue. Sometimes it's really important to have that medication to enable you to tolerate dealing with the issues. But when the medication is numbing and doesn't allow you to feel, then it's not helpful. So figuring out the triggers is another important step in dealing with addictions. When triggered by an addictive impulse, your body is just seeking that release of the endorphins and reminding you what you can do to get that release right away. So it's reminding you to do what it knows has delivered the pleasure in the past. And it's your job to change that connection, to change that old familiar strategy and develop new strategies that will give you reward, maybe not equal, but similar to what you were receiving before. Reframing is another thing that we use as psychologists to help with addictions. You can choose to reframe addiction and its compulsive urges as an indication that you're longing for some need to be met. And you get the help to learn how to actually identify and meet those needs in a new way. So addiction is the most powerful when you isolate yourself from others, and that's why we often see support groups such as this and AA that help with the addiction. So addiction thrives on being alone, whispering in your ear and blocking everything and everyone else out. So you seek help to transform your addiction into something that serves you rather being served by the addiction. Wanting pleasure is just human nature, and that's part of what we're trying to help you do is find new ways to feel that pleasure. And starting to look at food in a different way, just starting to look at food as fuel. Food isn't what you use to give you pleasure anymore, it's just like brushing your teeth. I mean, you do it because you need to stay healthy. You don't really look forward to brushing and flossing your teeth. So the same thing with food. We want it to just be something that you do because you need to do to keep your body healthy, but not for pleasure. We work on the cognitions, the ways that you think about food. It's kind of like those old tapes. You have this playlist in your head, and that's activated with the addiction. And we want to change some of those thoughts to be a new playlist that's a more helpful and upbeat playlist for you. So we talked about support. Spirituality for some people is an important part in overcoming the addiction. And then just really patience and practice. It's learning a new skill, and it's not comfortable oftentimes at first. You can probably relate to learning new skills. A new skill that I'm learning is pickleball. Have any of you played pickleball? The new rage, right? So I'm pretty bad at it, but
We know what it is now.
yeah, I played my son the other day who beat me. I think you play till 11, and I scored 3 at the most. So, I didn't give up. I kept playing, and eventually I'll get better. But right now, it's not as pleasurable of it as it will be when I get better at it. So the same with overcoming the addiction and learning the new skills. So I have a couple of just quick case examples. And this is someone who's transferred their addiction. So you can almost hear all addictions in this case example. So the name of this patient is Anne. She drank too much in her 20s, but outgrew that habit, and then went on to binge eat her way to a 40-pound weight gain. After trying a few fad diets, she decided the only way to lose weight quickly was to get a doctor to write a prescription for ADHD medication. So she's lost weight, but because the stimulants interfere with her sleep, she's also taking sleeping pills regularly. And since losing weight, she's obsessed with buying clothes and has gotten herself into quite a bit of debt outfitting her new figure. And just a few days without surfing the web for a cute new this or that makes her feel antsy. So she finds herself searching for something new to cope with the anxiety and emptiness she always seems to feel. That kind of covered all the addictions, I think. This gentleman I found who blogs about his journey in losing weight, and he speaks about just recognizing finally why he has needed to be on the journey. He said, "I've lost 290 pounds in the last 6 months, which I have been documenting. Hundreds of people have asked me, what miracle diet are you on? And he said, I'm not dieting. I removed 290 pounds of rage, fear, insecurity, and self-doubt that came from the negative social messages of growing up as a poor, badly abused child, messages my subconscious mind stored and plays like an endless iTunes playlist." So that's all that I have today. I'm open to questions, and I also have the whole presentation as a handout if you want. Any questions?
Got a microphone?
Did you mention something about passing out references or something?
The
Because
handout.
it doesn't have anything on it.
No,
Okay.
that was
Okay.
presented. Yeah, that was just the outline.
This isn't right.
Yeah, that was just the outline.
And we'll get a copy of this, and I will post that where I post all the other write-ups, either on the website for the surgeons or the hospital website. Yeah.
Can
Can you talk a little bit about healthy replacements for addiction, and then like a healthy habit to replace? But then how do you be careful that like exercise doesn't turn into an addiction as well?
Good question. So, right, so exercise would be considered a healthy substitute, right? But remember that CAGE acronym that I talked about. When somebody's telling you, and it's getting they're annoying, you're doing it too much, and it's interfering with your obligations and your responsibilities, and it's really all-consuming, taking up all of your extra time. So you're declining doing other things because you need to exercise. It's an obsession. it's a have-to thing. That's a problem. It should be something that you can choose to do rather than have to do. So, other healthy things that people use for rewards are doing something for themselves, going for walks with friends, doing massages, pedicures, manicures, doing things that are for pleasure that replace the addictive behavior that's not healthy.
I'll have a few more maybe while everybody's in groups. Okay, how many didn't get one of those? Is it 4? Okay. I'll get 4 more copies of that. Any other questions?
Can you just talk briefly about like mental health impact it has during the weight loss?
Weight? Sure. There's the complicated factor about mental health and weight is there's no one pathway, right? A lot of different reasons people have for being the way they are, but as far as the connection between obesity and mental health, oftentimes there are issues that we're numbing, and we're numbing them with food, not addressing them because it's uncomfortable, and sometimes it is started very early in life, so it becomes habitual and a habit, and you don't even realize it just seems like a habit as an adult, and you kind of have to go back and figure out where the source of those messages came from that are connected with food and your eating. For some people, it was growing up, the messages that they received, and it was what they could turn to for comfort when they didn't have other ways of comforting themselves. So there's no one answer for why that happens. That's just
My concern is instability going through this process because I'm very stable and I'm really not looking forward to being off medications. So, I mean, I don't know what your thoughts are or.
Well, I think I mentioned I'm not necessarily for being off of the medication. I think that sometimes the medication is really important to allow you to deal with the issues that you need to deal with, and working with your therapist, if you need to adjust those medications up or down to help you deal with the issues, and that person should be really familiar with you and the stability and what's going to help you and not have you cross that line into instability. So I think that's a good question.
Do you see many patients that come back to you and feel like they struggled with that after the surgery?
That struggled with
Instability due to medications, any changes in the medications?
And rapid weight loss, they're all kind of just concerns me. I have a friend who's done this, and she was diagnosed with bipolar. It snapped her into mania, and she was like in her 50s, because I don't know there had been other contributing factors, but it was just like, I've never heard such a thing.
right. No, I don't think that's as common. I mean, it was probably in existence before she had the surgery, right? It's not. And I think it's really, that's part of why we do those assessments before. It's hoping that we can be thorough enough to try to uncover things that we can help you with to be successful and not have the crises afterwards. So.
She wasn't a patient here.
What, I'm
She wasn't a
sorry?
patient here, but
Okay.
yeah, she had it done like not too long ago. It's like, it's really been hard.
And is she getting help now?
Oh, absolutely. But she was inpatient for a while to get the meds.
Right.
And she outpatient now, and she's stable.
Okay.
It's taken a while, so.
Yeah, so my guess is things weren't discovered that needed to be discovered beforehand. That can happen, it's not field proof, but we hope that we can be thorough enough to try to figure it out.
Anything else?
I know after the surgery, you can't take pills, big pills or anything, so if you are taking medications, do they
that's a medical question.
You will only be on for medications for about 24 hours. And so when you go back on them, depending on which surgery you have, you're going to see a little change in the absorption more with the bypass than with the sleeve, because we are bypassing a part of that small intestine. So if you're on an extended release medication, what we frequently will have people do is switch to an immediate release medication, and you'll take a smaller dose several times a day instead of just once a day taking that extended release. And I always recommend that patients pay attention to how they're feeling. I don't want you to imagine that you're more anxious than you were, but I want you to be aware if over the course of a few weeks you start to feel like you're a little more depressed, like maybe you're not getting the normal dose of medication. So you can talk to your doctor and they can increase that, and they may need to adjust that a little bit after surgery, just because it does alter your absorption a little bit. Or it can. That is not something I hear a lot from patients. No, that they feel like they're kind of, their medication isn't quite right.
I had my doctor already change me to my regimen that's going to be after surgery.
Perfect.
I
Then you
did.
probably won't notice anything.
That's exactly
And if
what I
it's a
thought.
large pill, you can always get a pill splitter and cut it up. If it's a capsule, you can open it and put it on some yogurt and take it that way.
But one of my drugs that is, falls in your mouth now, I mean, it's,
Oh, well, then that shouldn't be a
I mean,
problem.
it's very good.
Yeah, that shouldn't be a problem. Okay?
Can you talk a little bit about, not cross addiction, but the return of food addiction? Kind of how that happens within the cycle and what to do about that if it does? I don't know if it's something that happens, you know, some people regain their weight, and I assume that would be one of the contributing factors. So what
Well,
would be the...
in speaking to that, I think that's where we talked about not really addressing the initial problem that led to the food addiction in the first place. So if you're not getting the support that you need, the help that you need to deal with those issues, then it's very likely it could come back. And that's part of why we want to follow you afterwards, because we want to help prevent that from happening. So trying to nip it in the bud and catch it in an early phase and help you
I
address
mean, is that
that.
more common than a cross addiction, do you think? Like, just going back to the...
I can't speak to whether it's more common. I couldn't really find the incidence, a good statistic that told me the incidence of cross addiction occurring. There was a lot of variability in that. I don't know if you've seen
Yeah, and
anything.
that's what I've always seen, is that if they're, depending on which study you read, you'll get different.
Yeah.
Different.
Because I wanted a number to tell you, but I couldn't find anything that was.
Binge eating disorder would be more in that range of things that might come back a little bit.
Right.
And there's ways we can address that. And people who have, who started out with binge eating disorder, yeah, if you don't address the issue, then it can come back, but it's very treatable.
Yeah, absolutely. Yes.
You said you want to, like, follow us after the surgery. So, I mean, you make appointments for that, and if I self-pay, is my insurance cover seeing you?
If you're a self-pay patient, yeah, and you have insurance that covers psychological visits, that has nothing to do with the surgery itself. So yes, you can pay for anything like that.
So how often should we come and see you?
The recommendation is coming soon after surgery in 1 to 2 months. When you come for some of those follow-up visits, and then we can assess the need to continue. Right.
But I would say anytime you feel that you need.
Absolutely, and that's what I tell.
That's-
That's what I tell patients. Here's here's the schedule, but that doesn't prevent you from coming at any other time before or after surgery. Yes.
I just wanted to know how we switch from turning food into pleasure and into fuel. How do you turn off, that cheesecake isn't amazing,
Yeah, I kind of wanted that myself.
Right, I think that that's an individual prescription of how to do that, and that's where whoever's working with you helps to determine what could serve that purpose for you. We have to understand what creates that as a pleasure for you now,
So
and
you no longer enjoy cheesecake, it's like, it's not that good, you'd rather not have it. Or you get to that point, is that what happens?
I think that's a good, for some of the people that have had the surgery to discuss that and see,
They would say yes? Speak up.
I hear.
I enjoy the
A lot of
cheesecake,
people, if they change their.
but I just
Their
don't eat it
taste,
all.
right.
I eat a couple bites and then I know if I eat
Three
more,
bites.
yeah.
Because you don't need cheesecake for fuel. If you're just eating for fuel, then you're just eating the basics. You're eating the leanest protein, you're eating the best high fiber
Right,
carbs,
right.
and that's all you're doing.
And part of it is changing the way you're thinking about the food as well, right? I mean, that's a huge part of it. So instead of saying to yourself, I really would like to have that cheesecake, to be able to say, I can have a bite of that, but that's not really what I need right now.
It's
So,
not fuel, I shouldn't be eating cheesecake.
well, the should, that's where if you start to say the shoulds, I should or I shouldn't, then it becomes more of a problem. So just allowing yourself to have a bite of that at times, to not deprive yourself, because the all or nothing thinking, the shoulds, that can get in the way of you being successful too.
It does make a pleasure, right? Does that fall into the pleasure category?
What does?
The food does the cheesecake then fall into the pleasure category rather than the fuel category?
I think that's an individual choice, right? That's something that,
I don't know, I'm just trying to follow the food equals fuel, not pleasure. I'm just trying to get some clarification.
I'm only 3.5 months out. The doctor did my surgery, and my birthday's coming up. What do I do? I said, eat your protein, and you leave a little room, and GI centers, and I had a little biocarrot. And then I went to have another one. As soon as it was like the process, it takes me a little longer. Now it just go for 3 teaspoons without realizing it. The second that I went to take the second bite, I already felt the first bite being more, I had the protein, and it was like, do I really want to go into a nice restaurant and get sick? And I went, that was the first, it was the best birthday bite of cake that I've ever had. Because it had a purpose. It had a workout, I celebrate, I don't look at it as a reward anymore, but it's like, for me, it became more about, I like this atmosphere, I like meeting with people. Is there anything that I cannot have? No, but have more than you need to, like anything else. And the last place I want to visit is the bathroom. Yes, so that's, I mean, yeah.
go ahead.
I was just gonna say, I was getting like, I'm only 32 days out, and I started getting really depressed because I just kept saying, I can't have that, I can't have that. You know, my son, can we stop and get it? And I'm like, yeah, so no, I'm not stopping getting it, I can't have that. And it was just kind of like maybe 2 weeks ago that I started saying I won't, because can't is so restricted and it makes me feel depressed, and you know, like, oh, I'll never have a Coke. I mean, I could ball my head off when I see somebody with Coke. I mean, I drink 64 ounces of Coke a day, not water. And so I had to change it to I won't, because it makes me feel better about myself. It makes me feel like I'm making a decision for myself to live longer for myself, and I bet you I can see what's McDonald's. So I just say, yeah, so now when he said, I just say, I won't have it. I actually could McDonald's last night. It was kind of hard. Yeah, it was kind of hard, but I just kept thinking, I won't have that. I just make a choice for myself. Since I won't have that, I will live longer for them.
Yeah. And I don't know if anybody else, but we, I don't have to. There's nothing, I don't, the surgery didn't go start with the McDonald's, and now they judge this. Now I feel like I'm on good for that. People should be eating that stuff. So that is what I don't have to pray.
I'm about 4 months out, and what I've been told is that something in respect to head hunger. Could you talk a little bit about that?
Say that again?
Head hunger?
Head hunger.
Yeah, opposed to actual.
There's this hunger,
Right.
and there's this hunger.
Okay,
Heard
so
of that term before?
I have not heard of the term head hunger, but it makes sense when we think about how we're thinking about food. I mean, I guess that's not the phrase that I use. We talk about that, but I haven't labeled it head hunger. But yeah, it's the cognitive aspects of hunger versus the physical aspects of hunger. So yes, we work on what you're saying, and I think that's what she was speaking to in the back, was speaking to what you're telling yourself about, and being very aware of the messages that you're giving to yourself about food and hunger, and really getting in tune with the physical aspects more than you've ever been, and being able to talk through all of that. So, yeah.
Okay, thank you very much, Dr.